To follow, we will discuss dentistry at other shelters across Canada. Our intention today is to talk about case selection and flow of dental cases in a shelter setting. To help you gain perspective, I will start by providing some general information on the Ottawa Humane Society. We are open admission and we operate the municipal animal shelter. We have a 40,000 square foot facility that we moved into in 2011. Our animal intake in the 2020-2021 fiscal year was 4,006. Due to the COVID-19 pandemic, this number is much lower than our average animal intake the two previous fiscal years, which was around 7,500 animals annually. The Ottawa Humane Society includes two veterinary clinics that are accredited by the College of Veterinarians of Ontario. These clinics are the Ottawa Humane Society Animal Clinic and the Ottawa Humane Society Mobile Spay-Neuter Clinic. The Ottawa Humane Society employs 3 full-time and 2 casual part-time staff veterinarians. The roles of staff veterinarians are shared between surgery, shelter medicine, and providing services at the Mobile Spay-Neuter Clinic, which was operating 4 days per week before COVID. There are no public veterinary dental services offered. The Ottawa Humane Society also has a volunteer veterinarian program where community veterinarians volunteer their time to provide surgical services to OHS animals at the in-house clinic. At this time, we have 5 active surgical volunteer veterinarians. This is a photo of a volunteer veterinarian performing a dental procedure at OHS. I joined the Ottawa Humane Society in 2006, and back then we were primarily performing spay-neuter surgeries. Like most shelters, dentistry has become a common veterinary need for animals in our care, and adopters are becoming more knowledgeable about a pet's dental health and have expectations about good oral health when adopting animals. These demands have brought to light many challenges for shelters trying to meet their animals' needs for dental care. I don't have all the answers to these challenges, but I am hoping in today's forum that the sharing of experience, approaches, and ideas will benefit all participants. This chart shows the gradual increase in the number of animals receiving dental care at the Ottawa Humane Society since April of 2003. Our highest annual number of cats and dogs receiving dental care was in the fiscal year of 2014 to 2015, where 660 animals received veterinary dental intervention. The dental numbers in the 2020-2021 fiscal year were significantly impacted by COVID and a reduction in animal intake. This graph demonstrates that despite declining OHS intake numbers over the past years, the percentage of cats and dogs that are admitted to this shelter that require and are provided with dental care has stayed relatively stable. The range is 7.3 to 10% of cats and dogs admitted to OHS annually require and are provided with dental care. The slight increase over the past few years is subjectively attributed to enhanced training on recognizing dental disease and improved intake processes. The attempts to meet the dental needs of shelter animals has brought to light many challenges for shelters and veterinarians. For those shelters that have clinics within, finding staff that are trained and comfortable providing dentistry can be a challenge, including technicians and veterinarians. The procedures themselves require expensive equipment and can be quite time-consuming to perform, causing strain on limited shelter resources. Some shelters simply don't have vets on staff or a clinic with dental x-ray or a high-speed dental machine. Some shelters rely on sending dental cases out to community veterinary clinics where costs can be significant and wait times for care can be long. And then there are the many questions that arise. What is a standard of care for dental procedures in a shelter setting? Should I even do a dental if the shelter doesn't have dental x-ray available? What level of existing dental disease would or could we responsibly adopt out? What level of existing dental disease is reasonable for a new owner to take on? Would we use waivers? And how should I triage our dental cases? These are not easy questions to answer. If you have had these same questions, you are not alone. These are things that shelter veterinarians and staff have to grapple with as dentistry becomes a bigger part of our everyday caseload. Here is how we currently do it at the Ottawa Humane Society. First off, a few words on dental equipment. We have 2 dental machines, allowing us to perform 2 concurrent dental procedures when required. The second dental machine was acquired 2 years ago. Previous to this, we relied on 1 dental machine, and it was then even more important to ensure regular dental machine care and maintenance was performed. We have a DR Digital Dental Radiology Unit acquired in 2014. We will discuss later our use of dental x-ray in individual case management. We do not have a dental suite. Our dental x-ray unit is housed in our main radiology room. An anesthetic machine is present, and we require full general anesthesia before dental radiographs are performed. This has prevented the accidental dreaded bite to the sensor. We have a honing machine for sharpening dental instruments in-house. It is very important to ensure your dental instruments are sharpened regularly to prevent unnecessary tissue trauma and surgeon fatigue. Weekly trained veterinary technicians sharpen our dental instruments. I am not going to go into too much detail about dental instruments. There are many basic instrument sets available for purchase, and I will mention a couple of additional tools you may want to add in. Depending on how many different vets you will have providing dentistry, you may need multiple sizes of elevators to fit different hand sizes. In the photo on the bottom left, there are a few different elevator sizes. Also in this photo is an instrument we find really handy, which is root tip extraction forceps. This instrument can be used to grab tiny root fragments to aid in their removal. In the photo on the bottom right is my new favorite for deciduous teeth, a curved deciduous elevator. Veterinarians may have some specific instrument preferences, and having these tools available may increase extraction efficiency. With the high prevalence of dental disease in dogs and cats, we acknowledged some time ago that it is simply impossible to provide dental care to all OHS animals before adoption without prolonging length of stay and significantly impacting capacity for care. To manage this challenge, we developed a system of dental waivers. Our waivers followed a style format the Toronto Humane Society was using. We have 6 dental waiver types for conditions that are pre-existing but not deemed to require immediate dental intervention. Advanced or severe cases of some of these conditions would warrant immediate dental treatment, and therefore a waiver would not be appropriate. The waivers used at OHS are feline gingivitis, juvenile gingivitis, tartar, worn teeth, feline tip fracture of the canine tooth, and missing teeth. A new adoptive owner is provided with information at the time of adoption regarding the existing non-urgent dental needs of the animal in the format of a waiver. Waivers are only applied by veterinarians. Here is our tartar waiver. For example, a dog with moderate to marked tartar, mild gingivitis, no observable gum recession, and no obvious need for extraction on an awake oral exam would qualify for a tartar waiver. Each shelter will be unique as to what volume of dental care they can provide. Some shelters may not be able to provide any dental care pre-adoption and would be looking for new adopters to take on this need with their new pet. At OHS, we address anything that is likely causing pain, illness or infection, or conditions that would require veterinary dental intervention soon after adoption, typically within 3 months. When training new shelter veterinarians regarding which animals would qualify for dental care pre-adoption at OHS, I tell them to think about seeing the animal they are assessing as a patient in practice. If you would likely tell the owner of the animal that their pet would need to have a dentistry within a year, then the animal may qualify for a dental waiver or regular adoptions. If you would likely tell the owner that their pet needs something addressed immediately or even within the next 3 months, these are cases that we would provide dentistry for pre-adoption. This is an x-ray of a cat with a resorptive lesion in the crown of the 409. This would be causing pain to the cat and would be addressed before adoption. At the highest level, the OHS Asilomar and PET evaluation matrix guide decision-making for dental conditions. Ohs Dental Triage. For efficiency in case management and resource planning, a thorough dental examination at the time of intake is critical. Upon intake to OHS, the veterinary technician performs a thorough awake oral exam, temperament permitting. If the technician feels the animal likely needs veterinary dental care, they will reference an SOP to help determine approximate level of disease and care likely required by assigning a dental level of 1, 2, or 3. If the intake technician is not sure if a dental is needed or if a waiver might be applicable, a veterinary exam is scheduled. Identifying dental needs at the time of intake helps to ensure that every animal's oral health is evaluated before adoption. It also helps to plan and monitor resource capacity to provide required dental care. For example, if we know there are 5 animals with dental level 3 needs waiting for care, we can plan approximately what veterinary and technical resources will be needed to meet this need. Finally, dental needs are one of many inputs that are considered when pathway planning for animals. There are limitations to an intake oral health assessment on some animals due to temperament of the animal and staff safety. Staff training is critical to help ensure technicians performing intake examinations can perform a thorough awake oral exam and recognize common oral health conditions such as fractured teeth, malocclusion, gingivitis, etc. We have found practical training sessions to be the most effective in teaching oral pathology recognition as well as oral examination technique. Having a dental standard operating procedure for staff to reference is also beneficial. At OHS, all cats and dogs receive an oral exam before adoption by, at minimum, a technician, and some will require sedation to achieve this exam. In this photo, a technician is providing an oral assessment to a dog under sedation. Moving on to dental case flow at OHS. In order to reduce in-shelter population and help maintain capacity for care, animals that will have to wait longer than 7 days for a dental procedure are triaged to foster. Staff involved in dental assessments, as well as performing dentistry, are provided with the required training to perform their role effectively and efficiently. Routine post-dental checks are performed by trained technicians. Dental procedures are often staged to allow for the most efficient use of resources. Staging dentals involves performing the dental procedure in 2 separate anesthetic events. Staging dentals is something that significantly enhanced our capacity to get dental cases completed, especially when our vet and technical resources were more limited. A typical non-stage dental scenario looks like this. The veterinarian waits on standby while the technician does their scaling, polishing, charting, and dental radiographs. Once this is complete, the veterinarian then takes over and performs any needed extractions. In this scenario, it is difficult to strategically book your veterinarian's time in advance, as the time required for extractions for each case is often not clear until the scaling, charting, and dental radiographs are complete. The first steps of a dental procedure we call stage 1. A stage 1 is completed by an RVT while the veterinarian is present and available for quick consultation, but typically deployed to other tasks. A stage 1 procedure includes scaling and polishing the teeth, dental probing, charting, and dental radiographs as required per protocol. The veterinarian is consulted as needed to provide diagnosis and treatment plans. From there, an approximate time required to complete the needed treatment, typically extractions, is estimated, and the extractions will be scheduled for another day. The stage 2 portion of the dental procedure is performed by the veterinarian and includes radiograph review, oral assessment, and extractions as required. By staging dental procedures, the veterinarian can be deployed to other tasks while stage 1 procedures are being completed. It also allows for more strategic and condensed booking of vet time to complete stage 2 procedures, as the approximate time required for extraction is known in advance. For example, if you have a vet booked for a 6-hour surgical shift, you could potentially book 3 2-hour stage 2 dentals to make the best use of the veterinary resource. As far as cons go to staging dentals, some might consider repeat anesthesia in this category. However, instead of one long anesthesia, you will end up with 2 shorter ones, which can be beneficial in preventing anesthetic issues associated with longer procedures. The other possible concern to staging dentals is the concern over repeat movement of cats back and forth to the in-house clinic from their shelter holding area or foster. All shelter structures are different, but at OHS, we move animals to the clinic around the time of a surgical procedure. If a cat needs a stage 2 dental after a stage 1, they will remain housed in the clinic until the stage 2 is completed, ideally within 3 to 5 days, to reduce the stress of moving between cages multiple times. Moving on to dental x-ray, for those of us that are fortunate enough to have it. First of all, technicians need to be highly skilled in efficiently obtaining diagnostic dental radiographs. This does require training and often hands-on training, as there is a learning curve here. As far as what we radiograph, typically the technicians will go ahead and radiograph anything charted as abnormal during a stage 1 procedure. This would include things like frication, crown fracture, increased pocket depth, possible resorptive lesions, mobility, missing teeth, etc. They will often take full mouth radiographs for cats they are seeing more than one possible resorptive lesion. As technicians become more skilled in taking dental radiographs, they will often be able to get routine full mouth radiographs on a cat in approximately 10 minutes. As far as post-extraction radiographs go, at OHS, we simply don't have the resources to do post-extraction radiographs on all dental cases without reducing capacity to provide dental care to other animals in need. Post-extraction radiographs are taken on a case-by-case basis as requested by the attending veterinarian. Another question that comes up repeatedly from vets working with or for shelters and performing dentals is, aside from the obvious, what do you want me to take out and what can I leave? Clear direction on extraction criteria is critical to ensure consistency in decision-making for veterinarians performing dentistry for shelter animals. Typically, direction is most needed around teeth that are borderline with regards to meeting criteria for extraction. Extraction decision-making in a shelter cat or dog can be different than when performing a dental on an owned animal, where decisions about extractions are often made in consultation with the owner. Since pre-existing oral health conditions can be a barrier to adoption for an animal, our approach is to typically go ahead with extraction for teeth that are diseased and will likely need to come out within another year or so. This is our standard post-dental extraction care regimen. We have technicians perform rechecks for all dental extraction cases, typically at 3 and 8 days postoperatively. The technician will have a veterinarian take a look if they have any concerns at their post-dental check. We use softened food and no chew toys for 10 days. We use our foster to adopt program until healing is confirmed. Prescription medications are dispensed as appropriate on a case-by-case basis by the attending veterinarian. For the volume of dentals we do, complications are uncommon. We manage them on a case-by-case basis. The most common complications we see are extraction site dehiscence and lip entrapment after extraction of an upper canine tooth. Most all cases of lip entrapment due to extraction of an upper canine tooth resolve with time, typically within 8 weeks or so. In this photo is a cat that developed an abscess after a dental extraction. You can see the swelling of the cheek adjacent to the 107. Investing in dental training for staff involved in dentistry is invaluable by allowing for more accurate dental assessments and efficiency in providing dental treatments. There are many external dental training courses available, but don't undervalue the benefit of internal training, including on-the-spot training when opportunities arise. Dental x-ray courses for technicians on the practical portion of obtaining diagnostic images and for vets on x-ray interpretation are important. Practice and repetition is often what is needed for vets to get comfortable and confident with extractions. Occasionally, we will consult with dental specialists, usually for more complicated oral trauma cases or for highly unusual radiograph findings with uncertain treatment plans. We don't refer animals for root canal treatments. In this picture is Gulliver, a sweet young cat that came into our care suffering a gunshot wound to the face and jaw. He had extensive oral trauma and specialists were involved in his care. You can see the resultant right-sided mandibular drift that occurred due to his jaw trauma. I'm happy to report he's doing great and thriving in his new home after many months of care. Thank you for joining us this morning to talk about dentistry at the Ottawa Humane Society. Please feel free to reach out to me directly at the email provided here if you have any additional questions. We are hoping you will join us for the dental forum to follow, where shelter veterinarians from across Canada will join on the conversation about dentistry in shelters.
All right, thank you everyone for joining for that. We're going to move on now to our dental panel section. And I'm just going to take a moment to introduce our panel. So first of all, we have Dr. Melanie Youngs joining us from the Winnipeg Humane Society. We also have Dr. Amelia Juan Gordon from the BC SPCA, Dr. Gabrielle Callier from the SPCA de Montreal, and Dr. Clarice Halliday from the Edmonton Humane Society. So we're super excited to have representation sort of from shelters across Canada. And we're gonna have a conversation about dentistry and case flow in shelters. So the plan is we're gonna go through sort of one question at a time, and I'm gonna call on the panelists to answer and share information. If you have questions and you want to put them in the question and answer chat, that's perfect. We'll try to get to those at the end as well. I'll also share my email address again at the end. So if people don't get questions answered that they want, they can send me an email and I'll get back to you with the answers. So our first question is just going to be to get everyone kind of familiar with where all the panelists are coming from as far as dentistry in their shelters. So where are dentals performed for your shelter animals? So do you have an in-house shelter clinic? Are you relying on external community vet clinics? And also, do you use any volunteer or locum veterinarians, or do you rely on staff veterinarians? So maybe we'll start with Dr. Youngs, if you want to start with answering that question, and then we'll move through the panel.
Sure. So the Winnipeg Humane Society has an in-house shelter clinic. We have 5 full-time veterinarians. And so we will designate one veterinarian every morning to be performing just nothing but dentals. So typically it is a vet that does all of the dentals, although occasionally if we know that it's just a routine cleaning, then, you know, if staffing or flow makes it better, we will have a technician just perform the cleaning, but typically there is one designated veterinarian every day, just working on dental after dental after dental.
Okay, so so the veterinarians in your shelter sometimes will also be doing like the scale and polish portion of the dentistry? Yes. Okay.
Yeah.
Okay, let's move on to Dr. Carrier.
Hi, so we're very lucky as well. We have a complete surgical wing at our shelter. We happen to be lucky enough to always have 2 veterinarians that are in surgery, and we share the dentistry as the day goes on. Everything we can delegate to a tech will be done by a tech, even dental blocks and such things, dental x-rays. We have in the past, we've had times where we were overwhelmed with dentistry and we weren't as skilled. I think we're getting better over time. So we did use external vet clinics to do our dentals, but we thought that added to the length of stay. It was also costly and not always, it didn't always correspond to our expectations, and which brings the question, our expectations might be too high for shelter dentistry. We are not lucky enough to have volunteer veterinarians to do dentals, but that would be great. Maybe an occasion for education for those veterinarians that are not as skilled in dentistry.
Yes, those are very good points. Thank you. I think we'll move on to Dr. Juan Gordon next.
Yeah, so we have an unusual situation here in BC where we have 36 locations and they're all pretty small. Our largest shelters only take in about 2,000 animals a year. So we outsource all of our dentistry. So we work with over 300 community veterinarians, and all of our dentistry is outsourced to community practices. So that that definitely has a lot of challenges in terms of consistency, but we don't have the capacity, and none of our shelters are accredited veterinary hospitals, except for there are two. They're like adjacent to a veterinary practice, but those veterinary practices are typically doing public work and not shelter work. So even in those communities, most of the shelter medical care is still outsourced to other veterinarians. So it's a little bit of an unusual model. I've never seen anything like it before. And I envy those of you who have these big like in-house dental suites, because that sounds really cool.
All right, thank you so much. And then Dr. Halliday from Edmonton.
Hi, yeah. So here in Edmonton, we also are lucky to have in-shelter surgery suites. So our dental area is built into our treatment and surgical prep area. We have 1 to 2 veterinarians doing surgery each day, and we like to share the load. So often we'll have one vet doing dentals in the morning, one vet doing dentals in the afternoon, just to switch out. We occasionally have locum vets come in, but they're usually coming in because someone's on holidays. So it's not really an extra person, but just a set of hands to fill the space so that we don't fall behind in our surgery load.
Great, thank you, everyone. That gives our audience a bit of perspective sort of on where all our panelists are coming from. So we'll move on to the next question for discussion. So how are animals triaged for dental care in your shelter? Is there an intake oral health exam by a technician always, or do you use a veterinarian to determine dental needs for all cases? So we'll have a discussion about that. And I think we'll start with Dr. Youngs.
So at the Winnipeg Humane Society, we have a position called an intake technician. And so they stay in the intake department and they will do all of the incoming exams on the animals. Obviously, there's times when animals come in through other channels, and sometimes, you know, the vet might be the first point of contact and do the full physical exam. Other times it might be another tech. But yes, they do get a full intake exam, and the dental needs will be addressed at that time. If a technician ever has a question of whether it needs a dental or not, then they will confirm with a veterinarian. And then, yeah, their next step is always to have the dental work completed prior to adoption.
Okay, thank you. That sounds similar to our process. So next we'll call on Dr. Carrier.
So our intake exams are all done by animal health technicians, but there's always a vet nearby doing other exams for sick animals and such. So if anything is wrong with a certain animal, the techs will call the vet, and then the exam will be done by a vet. So if there's any dental problems, the vet will come. And there's also a law in Quebec, I assume you might have it in the rest of Canada as well. If we're going to go under anesthesia, a veterinarian has to do an exam beforehand. So the vet has to do an exam anyways. And so the vet and the tech will do the exam together and print out a sheet that will be given to the team in surgery, and that allows for us to kind of plan ahead the amount of time we will be needing for the dental procedure. So say if, for example, we have one canine to extract versus like general resorptive lesions in a cat. That's how we do it.
Great, thank you. I think I'll call on Dr. Halliday next.
Yeah, so we're quite similar to what they're doing in Montreal. We have vet tech does an entry exam on every animal that is behaviorally tolerant. And then we have a bit of a flow chart to allow them to determine if a veterinary exam is needed for the teeth. So, you know, a grade 1 periodontal disease where there's minimal tartar, no gingivitis, they're comfortable to call that a good set of teeth. And then the veterinarian isn't necessarily taking the time to check those animals, but if there's ever a concern, it is flagged for a veterinarian to check, and then we have a look at the teeth and similarly determine, is this going to be a straightforward fractured tooth? Is this a cat with whorls? Is this an old dog where there's a need to differentiate wear versus fracture? And then again, planning that surgery time and making the notes on the file so that they can be prepared on day of surgery.
Great, thank you. And I left Dr. Juan Gordon to last because she does have some documents that I think we could have her share now as far as sort of triaging dentals. So if that's okay, Dr. Juan Gordon, I think I have to stop my share so that you can share. Oh, no, I don't.
Oh yeah, I think I just took, like, it asked me if it to stop your sharing, and it did.
Oh, perfect. That's great. Okay.
So let's see here. How do
I think you could go to the
slideshow thing is covered by the Zoom thing. I just have to go to the one on the bottom. Yeah, so again, we have an unusual situation where we don't have veterinary technicians in our shelters. And so all of our intake exams are done by staff who are trained on the job. So they have a variable amount of training. And we only have 2 locations that have an animal health technician, and they're not there 7 days a week. So we have spent a lot of time investing in training materials for our staff. And this is an example of a poster that's in all the intake rooms that we made a few years ago using photos from a board certified veterinary dentist, Dr. Legendre. So you can see my tech and I made this, so like the formatting is could probably be better, but basically this is a huge poster that's like 3 feet wide, and it just shows images of what people might see at intake with brief descriptions of those conditions. So we're not expecting the intake staff to diagnose problems. We're expecting them to identify when a vet exam is needed. And so if there's any type of if there's any concern at all, if the teeth are not normal, then they are required to get a vet exam. So we don't ask them to stage periodontal disease or anything like that, but we do have also a booklet version of that poster. And this booklet is like a laminated material that can be disinfected, and we've issued them to all of our constables to carry in the field. So that way, at the end of it, there's a section on what conditions are considered under the duty to report that we consulted with Dr. Legendre on. So that's basically like what conditions, if untreated, constitute cruelty. And we really wanted to get vets and our constables and our shelter staff on the same page about that. So that's why there's this other format with this little book. And then last, and again, I made this, and like it's very amateurish flowchart, but essentially it starts on the left-hand side. And if any problems are noted on the intake exam, then the animal has to see a vet. And then over on the right-hand side, there's that big orange box. And that's really, those are the conditions for which we want to pursue treatment. So because we worked with over 300 veterinarians, it is not wrong for a vet to recommend a dental assessment and or procedure for something like stage 1 or stage 2 periodontal disease. But similar to what Dr. Hutchings was saying in her presentation about kind of where the threshold is, if it's not causing distress or pain, or it's not imminently going to, or it doesn't need to be assessed further, we will adopt with a waiver. We won't invest our resources on that, especially because we're relying on community vets who often have a wait of 3 to 4 weeks for dental procedures, or really for any procedure. We have a really terrible vet shortage here in British Columbia. So you can see there kind of how the decision-making flows. If they are painful, we put them on pain medication. If they are in protective custody, which happens a lot, there's a whole other kind of decision tree that happens to try to make sure that they are managed until they can receive definitive treatment. But I think, again, it sounds like our decision making is similar to everyone else, but our like kind of the pathway that it gets to there is very different because we are so reliant on our community. Oh, and these resources are available as PDFs. I have sent them off to Linda and Shelley, so they can be given to you guys if you're interested in them.
Wonderful. Thank you so much. That was great information. Yes, and it looked like in the Q&A there was some interest in getting your documents. So thank you for sharing that resource. I think I'm just going to have to go back to my share screen now. Okay. Just bear with me for a moment here. Okay, so our next question for conversation is, what is your capacity to provide dental care for shelter animals? I think Dr. Juan Gordon touched on this a little bit, but I'll call on her again at the end to see if she has anything additional to add. Essentially, we want to discuss, are you able to meet the dental needs of all shelter animals? Do you waiver some dental conditions? And do you adopt out animals with unaddressed dental issues that require immediate dental care with an informed adoptions for existing dental disease? Because I certainly know there are some smaller shelters out there who don't really have the capacity to provide dental care in any way. So we just wanted to start that conversation. And I think I'll start with Dr. Jans.
So yeah, obviously the first question, are you able to meet the dental needs of all shelter animals, is certainly something that's always in flux based on staffing experience of the staff to do dentals, and then just kind of the flow of the caseload. Obviously, I think that we do see a lot of dentals and it seems to be ever increasing. We don't just have to address the needs of the shelter animals that are going up to adoptions. I'm sure other shelters as well, you'll have stray animals brought in that are owned and that you can identify the owner, but they've been identified as having dental issues. So then you need to make recommendations to the owner or involve the animal protection officers or your, animal welfare staff in terms of, providing notices or tickets to those owners to ensure that dental care is followed up with. So we often see a lot of challenging cases that way. The only thing that we would waiver would be worn teeth. We do have a waiver for worn teeth if there is no pulp exposure. And it would have to just be like moderate dental tartar without gingivitis or evidence of any periodontal disease for us to place a dental waiver. And that's in those cases where it's, could they have a cleaning? Sure. Do they need one? No. And so that would be about the only thing that we would waiver. But we do not adopt out animals with unaddressed dental issues. We do take care of them before they go up. And I would say that we're probably pretty aggressive with our dentals in terms of just take more in anticipation that that animal may not receive dental care again in the future. So we just tend to like to deal with it and give them the best possible outcome going forward.
Great, thank you so much. Dr. Carrier?
So first, there was somebody in the questions asking how many animals we get in our shelters. So just FYI, the Montreal SPCA, I checked our stats, and in 2019, we got near 1300,000, no, wait, 13,000, 13,000 animals. Sorry about that. French is not working this morning. Thank you. So are we able to meet the dental needs of all shelter animals? I We try, definitely, when animals have painful things, like it was mentioned earlier, we will intervene. We won't always do dentals if there's a bit of gingivitis, a bit of tartar, and we usually don't have to waiver some dental conditions, though we do inform doctors if we think that conditions should be looked at in the future within 6 months or a year or so. However, I wouldn't hesitate if something like a pandemic happened again to waiver some adoptions, because I think our goal is to trust our community and trust our adopters to provide good medical care, so as long as they're informed. And this question makes me wonder if, because we're very privileged at our shelter, we have resources, we can do Ohs Dental, but if we were able to offer veterinary care to the public with low income, which is our goal in the future, should we do maybe less dentistry on our shelter animals and more for the public? So these are all very interesting questions, and I'm wondering what everyone thinks about that.
Thank you, Dr. Carrier. Yes, that brings up a very interesting topic of conversation. And I think that's going to be an evolving situation as dentistry and trying to meet dental needs, becomes more prevalent for shelters, and something we're going to have to make those kind of hard decisions and have conversations about. So I think next I'll call on Dr. Halliday.
So here in Edmonton, we do address any dental disease that would be causing obvious pain or discomfort. The majority of the time, sorry, this is our office foster cat. The majority of the time, we will use indemnities or waivers to inform adopters where there's minimal dental disease. So where we try to think where a realistic, reasonable client would be told by their regular veterinarian, your dog or cat might need a dental cleaning within the next year, but there's nothing urgent to address right now. So just letting them know that dental care is important, that there's no obvious concerns right now, but that in the future, a veterinarian will probably say it's time, and just so that they're aware of that beforehand, and maybe making some choices about foods or talking to their veterinarian to do some preventive care prior. So we definitely don't adopt out intentionally with any dental disease. Occasionally there's one that might go for its complimentary vet check, and certainly then we also have the system where we are allowed to evaluate animals that have been adopted for 14 days post-adoption. So if there are any concerns that do come up in that time, we certainly do have those animals come back and address that, because we do want to be, adopting out animals that are healthy, that don't have immediate health concerns.
Great, thank you so much. And I'll call on Dr. Juan Gordon, see if you have anything you'd like to add to this.
Yeah, I think I already answered the question pretty much for like your standard cases. The one thing I will add is that we do euthanize animals for dental disease in some like narrow circumstances, and I don't know if others do this as well, but if we have rabbits or guinea pigs, like if we have animals with molar overgrowth where we know that they're going to require dental procedures under anesthesia like every 3 to 4 months for the rest of their lives, we will euthanize them. We don't have the capacity to deal with any sort of malocclusion issues in small mammals, except for like incisor malocclusion in small rodents. We have very little, like throughout the province, there's only one dental specialist clinic, and most GP vets aren't able to do that type of work. So we really have a situation where the animal is very likely to suffer in the future. The other cases that we do euthanize are cats with severe stomatitis. We probably only treat them with full mouth extractions about 50% of the time, and it's very resource dependent, and we have some locations where there are no vets who are willing to do that procedure. So those are also animals that are in a lot of pain, and if we don't feel like we can relieve it or the long-term prognosis isn't great, we will euthanize them. So that hadn't come up yet, but part of our dental kind of deciding who gets care does unfortunately at times involve making euthanasia decisions. And again, it is largely due to just the lack of veterinary resources here in British Columbia.
Thank you so much for sharing that. Yeah, I think that's very helpful information for other shelter vets and staff to have. So thank you. So we'll move on to our next question. So this is sort of a more open-ended question. What do you see as challenges or barriers to providing dental care for shelter animals? I think some of the panel have sort of touched on pieces of this, but we'll see if there's anything to add. So we'll start with Dr. Youngs, Ken.
So yeah, really just, staffing and, staffing experience in terms of how quickly they can get comfortable at doing dentistry. Obviously, we have the need to be able to do, at least 5 or 6 dental procedures every single morning to even try to scratch the surface of keeping up with our caseload. And so not everybody is fast enough to be able to accomplish that goal. I really liked you sharing that you guys have 2 dental machines. We only have 1. And so, yeah, if it goes down, then cases are backing up. And so that can be a challenge. Not that it happens often, but it certainly does happen. Or there's times when, a vet is in a dental procedure and something unexpectedly comes up at the time of intubation. And, I have drilled canine teeth on the floor of the dental suite while the other vet is still completing their dental. So 2 machines would really be helpful to improve that for us.
Thank you. Yes, the 2 machines were, a great addition for us. And yeah, we grappled with some of the same issues you're talking about before we added the 2nd machine in. So maybe next we will go with Dr. Halliday.
Yeah, yes, the dream of 2 machines, because everyone dreads finding a fractured canine in a dog spay when someone else is doing an extensive cat oral dental would be lovely. We also have 1 machine, and it does, we do our dentals in the surgery prep area. So one of our challenges is balancing the surgery time to get those fast track animals through surgery for routine spay neuter with the use of the space to do a dental on what would very much be a much slower track animal. Staff is always on the list. We do have a fairly consistent staff, but there's always some turnover, and then you're retraining your new staff that are coming in. Even if they've come from private practice, it's certainly a different decision-making process. So it can be a bit of a challenge to adjust to that. One of the other things is just dealing with that length of stay. So how long an animal is going to wait for that dental procedure, determining if best to get them out to foster, utilizing those resources, because all of that comes into the decision-making on investing in that dental procedure.
Thank you. Yeah, we certainly share in those challenges as well. Dr. Carrière?
We have the same problems as everyone else. It's really nice to hear you guys talk about this, so we know that we're not alone. So it's always trying to figure out how we use our resources to best suit all the animals, so that to reduce our length of stays overall. That we are lucky, very, very lucky, that we have a 2nd dental machine. So it does allow for us to extract the canine on another animal while someone else is getting complete dental. And I think for us, what's been a challenge in the past is we weren't as good in dental. We improved a lot, the whole team. Like we couldn't extract the canine, say 7 years ago, and now we are much, much better, but that's still a challenge, especially for new vets and new techs with the x-rays and all that.
Yes, I completely hear you on the staffing issues and the training that goes into getting staff up to speed on being efficient and comfortable with dentistry. Dr. Juan Gordon?
Yeah, so I think for us, the barriers are access to timely care because of the vet shortage, as well as consistency with decision making between all these different external veterinarians who have all their different own standards of care. We also have length of stay concerns, but we typically just deal with that by putting animals in a foster to adopt. Like we won't hold them in the shelter just waiting for the dental. Then they are still in our care, requiring our oversight and preventive care, and kind of they're still on our taking up resources. And the last thing is cost. So we track our dental costs kind of separately from other medical budget expenditures, and we spend at least $300,000 a year on external dental care, and it goes up every year. So we get a lot of like questioning and kind of just like we're often kind of trapped between like community vets who need to charge more to cover how intensive these procedures are, and then our kind of our board and like the budget, and the people who aren't vets that don't understand why this care does cost so much. And so a lot of like my job is trying to bridge between all these people and training our staff to collaborate with community vets, which in some cases means pushing back, whether the vet is saying this like stage 1, highly adoptable dog needs a dental before adoption, in which case we decline it. Or on the other hand, the vet might say that an animal with like severe pathology doesn't need extractions, where we're like, but this animal's in obvious pain. So we definitely are kind of constantly kind of facing all of these challenges. And I think that's probably the case for many smaller shelters and rescue organizations, where like even though we're a large organization, each shelter functions like a small unit. And so I don't know if others in the audience are experiencing that, but I definitely think that is something that when you can't do things in-house, a lot of these problems start to come up.
Thank you very much. Yes, I hear that as well, because I remember back when I started, we were outsourcing a lot of dentals to community vet clinics, and we experienced a lot of the same challenges. And I agree. Yeah, I think some smaller shelters or rescues certainly grapple with those same questions. So we're going to chat a little bit about dental x-ray. So we just want to have a conversation about, do you have dental x-ray in your shelter clinic? Or I guess for Dr. Juan Gordon, the conversation will be maybe more around criteria for dental x-ray, in the clinics that they're having their dentistries done at, and what do they approve or request to be done. And if you have dental x-ray, what is your criteria for use? Are you doing full mouth x-rays on all animals getting dentistry? Are you only radiographing teeth with pathology? Do you do standard post-extraction radiographs? And for those who don't have dental x-ray, are you limiting the dental work you can do, that you do because of this? So we'll start that conversation, and maybe I'll call on Dr. Youngs to get us going. Sorry.
Yeah, so we do have dental x-ray. How it's used would be at the discretion of the vet who's doing the dental. I would say, in speaking for myself, I tend to use it a lot more in cats, obviously, because resorptive lesions are a big issue that we deal with. And so I will use it to identify what I need to do. In the dental, I do not routinely do post-extraction x-rays unless I have a concern that I've, left a root tip or something. But otherwise, typically, like I said, I tend to be very aggressive, where I'm more likely just taking a tooth than questioning whether or not it needs to be. So if I have furcation or a pocket, I'm probably just going to take it rather than x-ray and quantify how much bone is left, because it's eventually likely to be a problem. And I just wanted to add one thing that that came to mind with the last question, just in terms of one of the vets mentioning about doing their dentals in the treatment room or the surgery prep room. And we also used to do that. And we've actually repurposed one of our exam rooms as a dental suite. And that's kind of been a game changer in terms of us being able to improve our flow in terms of how many dental procedures we can do. We're also very limited on space. And so sometimes it's getting creative. And that's what we did to get the dentals out of the treatment prep room so that you weren't taking up a table, and kind of keep everything contained in one area. So we have our dental x-ray in there with us. Yeah, it's in its own little self-contained suite.
Great, that's fantastic. Yes, I wish we had a dental suite as well, because I know it is way more efficient too. Especially, you know, moving animals back and forth to X-ray from, we do our dentistry is also sort of in our surgery prep area. So it just adds to the time as well. All right, so next we'll call on Dr. Halliday.
So we do have dental X-ray. It's built into the wall above the table we use in the treatment room. So at least we aren't moving back and forth to a separate X-ray area. But yes, the dream would be to have a beautiful suite with 2 tables and a dedicated area, certainly to keep that flow moving. Typically, very similarly, we X-ray at the discretion of the veterinarian. So cats with orals would be the most likely candidates that would end up with full mouth X-rays. Otherwise, in dogs, it's, you know, if it's a fractured tooth, to just often assess the health of the tooth underneath the gum before you extract. So are there any other fractures under the gum line you need to watch out for while you're doing that extraction, that sort of thing. On the obvious extractions, I too myself don't always take that pre-X-ray, but I will X-ray the ones where I think that the tooth might be able to stay, and assess it that way first. And similarly, unless I've got a concern that there's a piece of tooth remaining, we don't typically do the post-extraction X-rays.
Great, thank you. Dr. Carrier?
So we also have the X-ray, the dental machine and the X-ray in the pre-op room, and it would be lovely to have its own spot for dentals. But we do have the X-ray, and I don't think I could go back once you've had it. It's so like those cats with resorptive lesions, it's a game changer. Though, however, like most of you, I think most of our veterinarians won't necessarily do X-rays for everything. If it's an obvious broken canine, we can just go ahead and extract. Same with dogs with periodontal disease and such. And I think most of us will do post-extraction radiographs, but then again, not always. We go by feeling. And I don't see how I could go back to not having the dental X-ray, but I'm very aware that this is speaking from a place of privilege. We're so lucky that we have that machine, and I don't imagine every shelter can have access to this.
Great, thank you, Dr. Carrier. Dr. Juan Gordon, we'll get you to join in.
Yeah, so we it's just really variable. It depends a lot on the originating clinic. We do still have clinics in BC that don't have dental X-rays. And so because of that, we haven't tried to enact any type of standard or anything like that. If the shelters reach out to me and they say, like, I have this one vet who can do this and another who can, and it's a particularly complicated case or something, I'll often informally tell them, like, hey, this is a case where dental X-ray would be really beneficial. We have had a number of adopter complaints because of animals that went to a vet that didn't have dental X-ray and like had an incomplete treatment as a result of that, and then came back to us saying that another vet told them they needed another dental shortly after adoption. And so I really like working with vets that do have X-ray and are more thorough for that reason, to try to avoid those complaints. And also, obviously, then that means the animal is uncomfortable. But that said, like we don't have any strict requirement or anything like that, because it's just infeasible at this time.
Okay, thank you. And I'm just wondering if any of the panelists sort of want to comment on this, because this does come up for veterinarians working in shelters, you know, that don't have dental X-ray, and, you know, maybe a new vet working in a shelter may feel unsure as far as standard of care. You know, is it okay to go ahead and do an extraction if they don't have dental X-ray? You know, I certainly know we got our dental X-ray in 2014. We definitely did dentistry before that, you know, thinking we're trying to make the animal as well as possible before adoption, treating the disease that we could see above the gum line. But I just wanted to see if any of the other panelists wanted to sort of comment on that, or any words about that.
I could make a comment. So we've had dental x-ray here since I've joined. I've been here for just over 3 years in Edmonton. But I certainly recall being a new grad who didn't have dental x-ray when I was in my first practice. And leaning on that experience, I think knowing what I know now and having that x-ray privilege, you're probably still able to address those teeth that are obviously infected, obviously painful, and obviously need extraction. The downfall would be you might miss some teeth and not be aware of what's under the surface, but you're still going to provide an immense amount of comfort by taking the teeth that you know are causing pain. Yeah.
Did any of the other panelists want to comment on that? Nope. Okay, we will move along. Thank you. So we've touched on this, but I'd like to go into it in a little more depth. As far as, do you have difficulty finding staff, such as, technicians, veterinarians experienced in performing dentals? And what sort of training do you offer for staff involved in dental triage and treatments? So I think I touched a little bit in my presentation sort of on what we do, but wanted to touch on that from the other shelter representatives. So we'll maybe start with Dr. Halliday.
Yeah, I think just like anywhere, you come with a variable amount of experience and background knowledge. We do get quite a lot of new tech grads joining us, so they often are feeling quite uncomfortable with particularly dental x-ray. So we have in the last few years brought in some local vets and techs that have just more advanced knowledge. They've either done more training. They may not be fully board certified, but they've certainly got a higher skill level than we do. And they've done hands-on CE courses for us in shelter in the evenings, just to help get an overall group improvement in our techniques. And certainly people are always encouraged to pursue if they're interested in being better at dentistry with their CE budget for the year. But I did find that after we've done a couple of those group sessions with the staff on site, everyone thinks they're the only one that struggles. And I think there's a bit of camaraderie to realize like we're all getting better together, and we can all be better and learn from each other and help each other when we're having problems. So those group CE nights were quite beneficial for our team.
That's great. Thank you. Yes, I would have to agree, like the practical hands-on training in your own facility seems to be the most effective. So I think next I'll call on Dr. Youngs.
Yeah, so we obviously will find, it challenging to get veterinarians who are new to our staff that are comfortable performing dentistry. So we'll always support them and encourage them to use their CE budget to, pursue additional training if that interests them. But otherwise, the more senior or more experienced vets are always available to be called in to help, to provide demonstration, or, just for the first little bit while they're getting started, have them paired up with another vet to observe their procedure and be kind of helped along and shown how to do it, with our own equipment in-house. So we do provide a lot of mentorship that way.
That's great. Thank you. Yes, I think the mentorship, case consultation, on the fly training is also very effective. Dr. Carriel?
So same as everyone else, I think we learned together. We were lucky enough that we hired new techs, new vets that were better than we were, and that taught us over time. And since there's always at least 2 veterinarians and several technicians on the floor in surgery, we can help each other. And I think we kind of grew together with the help of the new staff and those that are extra interested in dentistry. I, for one, was terrible 5 years ago. I'm very thankful to the team.
Thank you for sharing. And then Dr. Juan Gordon, I guess you could maybe speak to sort of the capacity for you guys to find clinics to take on your dental cases and that side of it.
Yeah, definitely. So we definitely have trouble finding clinics that can perform dental cases. And we do have 5 veterinary hospitals, but they just largely serve the public. So in those hospitals, we have a ton of trouble finding people. But I don't know if it's, I mean, we have had definitely newer grads who wanted more support learning how to do dentistry and were sent to CE in that. Our technicians are trained by like the company that sold us our dental x-ray machine will send RVTs to the practice and train the technician. So if we have someone new, we'll often have that person come out and kind of do a refresher. But we have lots of really good long-term technicians in the hospital where I work in Vancouver. However, it's a 3.2 doctor hospital and we're running it with 1 doctor and we have been for like 2 years because we just can't find doctors. So at this time, like we do almost no dentistry there and we used to do a lot for like people who are low income and for the shelter. So I think it's just mainly the personnel shortage that is our biggest challenge.
Thank you so much. All right, so our next topic of conversation, at what point after a dental with extractions do you adopt out animals? Do you use a foster to adopt program during healing? Do you wait until they're fully healed before adoption? And do you perform dental rechecks on all of your dental extraction cases? So maybe we'll start that conversation with Dr. Youngs.
Yeah, we used to kind of routinely do a lot more checks afterwards, and I guess because we're streamlining things, and maybe we just feel more comfortable with how we expect them to do after the fact, that I find lately we're not doing as many rechecks, and we will typically adopt them out the very next day. So mostly what we will do is a next day welfare, comfort, appetite check to see how they're doing, if the pain medication is adequate. And that would be more for the, extensive dentals that need full mouth extractions, and that sort of thing.
Okay, that's great. Thank you. We'll go next with Dr. Carrier.
So same, we would adopt our animals the very next day if they're eating and everything seems okay. We don't wait before they're fully healed. We don't want to increase the length of stay or overwhelm our foster families that are so generous. We don't do rechecks on every mouth. We probably have more problems than we think, but we take a chance and we're hoping for the best, and we will see the animals if there's clinical signs of discomfort that our text tells us about.
Thank you. Dr. Halliday?
Yeah, so we do our post-op check next day. Not necessarily evaluating the extraction sites, but comfort, appetite, similar to everybody else. We interestingly, because we feel like dentistry is an area that we all would like to improve on, we have hounded some veterinary dentists with questions like, well, what should an extraction site look like after 3 days? And truthfully, nobody could really give us an answer because they said, we don't even touch them. We don't look at them till at least day 7, maybe day 14. So we're trying to adopt that mentality that probably looking and disrupting them could be more detrimental than just letting them be, knowing that you have improved your techniques and you are hopefully doing a better job of closing those flaps. So certainly we are trying to move more towards the place up for adoption quite quickly. Usually it's within 3 days here. And having that sort of more open adoption process. And then we are, like I said in a previous question, we are able to have them back for rechecks within the 14-day window. So if there is an issue with dehiscence or something like that, we are able to offer that follow-up service for an adopter.
Great, thank you. Dr. Juan Gordon.
Yeah, so for us, this is highly dependent on which vet does the procedure in terms of whether they're rechecked. We do adopt out animals immediately after procedures, like others have said. We'll often finalize adoptions. If for some reason, if it's something really complicated or the vet really wants to recheck, we will sometimes keep them in a foster to adopt. We definitely will not keep them in the shelters. Just waiting for that. And I personally like to perform dental rechecks on all my cases where I do extractions, but I think, more recently I've noticed that that's just not feasible for many people in the community, because you're giving that appointment spot and you're using all that staff time, and 99% of the time the animal's fine. So it's one of those things where, like, just because veterinary capacity here is so low, I've noticed even like private practice vets not doing rechecks as well anymore.
Great, thank you. And just to add to this, I'm just curious, and I don't know if we've touched on this, but do any of the panelists in your shelters, do you adopt out animals ever and then have them come back for their dental procedure, like post-adoption, like with a voucher, if your resources kind of become strained and you think it's going to be a prolonged length of stay to get that dentistry done? Is anyone taking that approach on the panel? No.
We haven't yet, no.
We haven't. I think we should probably. What we're doing now is we put them in foster homes. But why not find the permanent home, right?
Yeah, similarly here, we're not doing that. We're more limited by once the animal has an adopter. The ABVMA has limited what we're allowed to do. So offering a waiver, it would just complicate that relationship for us.
Yeah, for us, we would be using the same vets anyway on the same timeline. And often the vets prefer, like if they're shelter animals, they prefer to just deal with us, and like they know our protocols and they know that we'll like organize all the logistics of the appointment of the foster or the whatever. As soon as the animal is owned, then something happens where it's like, oh, your canine is fractured. And then the vet is saying, well, there's these different options. Your animal could travel for 16 hours and have a root canal, and then it has to be re-radiographed in 6 months, and every 6 months forever. Like, and then the adopter is like, oh, maybe I should do that because it will save the dog's tooth. And it's like, no, we're not paying for that. Absolutely not. And so we don't do that. It's too much trouble.
Thank you. Yes, I agree with Dr. Juan Gordon on that front. Yes, it becomes way more complicated when you have an owner involved in the decision making. Yes, so we also try and just get everything done pre-adoption at this time. I just thought I would throw it out there for discussion. So we do have a little more additional time. The panelists were not prepared for these questions, but I'm going to go ahead and throw them out there because we've got a little bit of extra time. So I mentioned in my presentation about tool sharpening, and I know it's something for years that we did not stay on top of. And now that we do stay on top of it with our own honing machine, it's made a huge difference as far as, tissue trauma, surgeon fatigue. So I was just curious if the panelists could each maybe comment on, if they sharpen their tools, if they do it in-house by hand, or if you're not sure, that's fine too. We'll just move on to the next panelist. So maybe we'll start with Dr. Halliday.
So some of our veterinary medical assistants are trained to hand sharpen our tools. There are some that definitely feel more proficient, and they're usually the ones that are tasked with doing it. Certainly a machine type process would probably be more efficient, and then allow staff to probably be more comfortable doing it rather than relying on one or two people that have more experience.
Thank you. Dr. Young?
The same for us. We also have veterinary assistants who are trained to use the stone for sharpening. But yeah, I'm finding myself questioning right now. I don't know how much they're keeping up with it or how often that's getting done. And I'm definitely interested in getting some information from you about the honing machine so that I can appeal to the powers that be to get us one of those.
Thank you. Yes, we found the honing machine to be a great investment. There is a bit of a learning curve for staff using it, of course, but it has certainly made a difference. We've noticed a big difference in the sharpness of the instruments. So Dr. Carriere, what do you guys do for your tool sharpening?
I also envy your dental sharpening machine, and I'd like to know where you purchased it and how much that costs. So what we've been doing, first we've been swearing and complaining about the instruments, and then we decided to get a second kit so that we could send them out to be sharpened by an external company, because some people can do it very well for us. And this is after asking some dentists for humans what they do, and they were like, what do you mean, like sharpen your tools? Aren't you like just changing tools? So this is definitely, it's worth the time to have them sent out or sharpened. Our techs do sharpen them with the stone, and it helps quite a bit, but sending them out once in a while is really helpful.
Great, thank you. Dr. Juan Gordon, I don't know if you'd have anything to add on this front.
Just that I want to hear more about this machine. We do manually sharpen things, but I think it's infrequent.
Yes, so I can certainly try and get more information on the honing machine. Anyone who wants info, I'll put out my email address again afterwards. They can email me and I'll try and provide as much detail as I can as far as cost and where we purchased it, because off the top of my head, I don't remember. But I do know it's a very effective way at keeping the instruments sharpened. There are training videos available on YouTube on how to do it. So the technicians essentially have been able to watch the videos and sort of teach themselves. And like I said, it's been a very effective way. So the other additional topic I just thought we could touch on, time permitting, and I think we still have some time, is just complications with dentistry. You know, they happen. If you're going to do dentistry, there's going to be obviously complications. If the panelists could just take a moment to touch on what they see as the most common complications, and maybe, you know, how they deal with those. So things from my presentation, you know, the most common things we see are dehiscence of extraction sites, and then lip entrapment if we extract an upper canine tooth, so that, you know, lower canine tooth kind of snagging that upper lip and causing some trauma and inflammation. I would say overall our complications are uncommon, but those are the most frequent ones we would see when we do have complications. So maybe we'll start with Dr. Youngs to see.
Yeah, I would say that dehiscence would have been the most common complication, like especially, you know, upper canine teeth, but we have changed our technique in terms of how we do our flaps. And now I find that that's a very infrequent occurrence, but there are still times when we will have dehiscence. And I would say very rarely from those, we do sometimes have to take them back to surgery to, you know, drill off some bone and, you know, create a new flap, that sort of thing.
All right, thank you. Dr. Halliday?
Again, I think our most common problem would be dehiscence of the surgical site. That would be our largest struggle. And so we do, particularly more for dogs, find that they have to go back in for surgery, whereas cats are magical creatures that often heal themselves so well with time, and then those ones will end up just in foster care whilst healing. But certainly we're always looking for ways to improve our techniques and improve our flap health so that we can avoid those.
Great, thank you. Dr. Carrier?
So we see the same complications, dehiscence and things like that, but there are the complications during dentistry. You know, when you push that little tip of those lower premolars in the canal in the cats. So that's happened to all of us quite a few times. And we do love that what you shared earlier, that root tip extracting tool. Sometimes you have to dig a lot deeper to get those little tips that are out there in the canal. Also, we've seen some, well, you know, when these animals come in and they have osteomyelitis, if I'm saying it properly, they barely have any bone left, so you extract a tooth and there's non-union or even like a fracture of a mandible. So we've had some of those cases and like older animals for which we just decided to monitor, and I have no idea if we did it right. The animals seemed comfortable, but we're always questioning what we're doing in dentistry.
Yes, it's an ever evolving topic for sure. I'll second that though, Dr. Carrier, with the osteomyelitis and the mandibular fracture, say after extraction of the lower canine tooth. We've had great success in just sort of managing those cases conservatively. And they tend to do very well. They get sort of a fibrous non-union that occurs. Usually we'll follow them maybe 6 to 8 weeks after that, just before we place them for adoption. But we also take a conservative approach in those cases, and we've had great success with that. All right, Dr. Juan Gordon.
Yeah, so most of the dental procedures that I do myself are on owned animals. So I think that in our shelters, because of the nature of my role, the complications that I tend to hear about are like really bad. So I tend to hear about it the most common complications that I hear about are things like animals dying under anesthesia, endotracheal tubes that get bitten off and get stuck during recovery, jaw fractures, like animals that have incomplete dental procedures and they're in pain afterwards. And then we realize that there's like a whole bunch of roots there. There's like abscesses and problems and those sorts of things. I don't think those are the most common complications statistically. They're just the ones that I tend to hear about because others don't, like I don't hear about ones that have practiced and deal with on their own in the community. So I feel like I've heard about like all the terrible things that can happen, and it's a bit sobering. But in general, with routine dentistry, I don't think we see a ton of serious complications that impair length of stay or anything like that. I think they can mostly be dealt with in the community.
Great, thank you. We're just going to take a minute and go through some questions that have been posted by the audience. So we have a question, would a solution be for more vet tech schools to train their students on dentistry? And I'll get the panel to kind of chime in on this as well. I would say yes. I think that would be a great solution. I think it's something that needs to be enhanced in the vet tech and veterinary curriculums, because I don't find there's very many technicians or veterinarians kind of coming out of school feeling confident and comfortable with performing dentistry. There's a lot of on-the-job training that occurs, but I don't know if we can get a couple of people, at least from the panel, to maybe comment on that as well.
I feel like some of the younger techs are coming in, the ones that we have that are doing kind of internships with us, they're better. So I think it's improving in tech school, definitely.
That's great.
We would definitely love for our techs to be allowed to do extractions. So they clearly are not allowed under the licensing body to do so. And in the same breath, we'd also love them to be able to do cat neuters as well, which they are also presently not allowed to do. But yes, I think that it would be very helpful for us when we do not have the veterinary resources to do it, to be able to have the technicians kind of take the reins a little bit.
Thank you. Yes. Did anyone else want to comment on that, or we can move on? Okay. There was a participant who was just asking if each panelist could just maybe shout out their annual kind of animal intake to give the audience an idea of the size of the shelter. So we had Dr. Carrier's. So Dr. Young's, not sure if you want to go ahead and start that, or.
Yeah, I don't have those numbers off the top of my head because I'm not the one following the stats, but yeah, we would be up in the same ballpark of probably over 10,000, I'm sure.
Great. Dr. Halliday, if you know.
Yeah, I think we're at about 4,500 a year.
And Dr. Juan Gordon, I think you may have mentioned it, but if you want to.
Yeah, so we have 36 locations, and the largest ones only take in about 2,000 animals a year. So they're still pretty small. Across the whole organization, in terms of actual shelter intake, we're usually sitting at around like 20,000 or so for the whole province. So, but it's very, very spread out. So wow. quite different.
Great, thank you. There was a question asking about, can you use the honing machine to also sharpen your surgical scissors and grooming blades? That's very interesting. I'm not sure. We have not extended the use of the honing machine at this time beyond sort of the dental instruments, but that's certainly something I'm going to look into because that would be really handy if we could use it for other purposes as well. And there's a question, Dr. Youngs, can you elaborate on your adjusted technique for canine extractions?
Can I flip my video around maybe? I'm not going to try to draw anything, but
Okay.
Can you see my camera?
Yes.
Can you see a picture of a cat tooth?
You may be able to also share screen if you'd like, but we can see that. Yeah.
Oh, okay, because I can't see myself, so I can't see
Okay.
what you guys can see and what I'm doing.
Okay, that's okay. Yeah, we can
But
see.
you can see. So the way that I was trained initially was I would just make a single a line following the arc of the root, and then I would elevate open a window. And I found that that had a lot of dehiscence. And then we started making one continuous flap, kind of like this, and then elevating that up and over so that then you could drill away the alveolar bone. And I have found that over time, I have just widened that window so that I am making more of an angular cut this way, and then following a much wider angle this way, and then elevating that entire flap. And that has eliminated all tension and significantly reduced any occurrences of dehiscence.
Great. Thank you so much for sharing that. I think that will be super helpful. I know the cat canine tooth is one of the most common ones we have to deal with problems in.
Yeah.
I'm just seeing if there's any more questions. All right, I think that seems to be it for questions, and we're pretty much out of time. So I am just going to once again share my email address here. So if anyone is interested in more information on anything we've discussed today, or especially the honing machine seems to be have created the most interest, feel free to shoot me an email and I'll certainly get back to you with the information. And I just want